And to our workshop on building resilience of young people with additional needs through COVID-19, spelt wrong, COIVD-19, I apologise for that already. My name's Alice McColl, and actually I'm delivering this session in partnership with my colleague Carol Robinson. Carol, do you want to just say your role quickly? I'm so sorry it's not on this slide.
That's quite all right. Yes, I'm Carol Robinson. I'm from the I'm an associate of the National Development Team for Inclusion, and I'm also a member of the Preparing for Adulthood team, and I cover the South West and the West Midlands.
Thank you.
I've been involved in one of these programmes a bit.
So we are from the National Development Team for Inclusion, which was mentioned earlier in the Delivering Better Outcomes Together programme, which Fiona referred to in the targeted part of the SEND delivery programme. And we'll come on in a minute to describe the Preparing for Adulthood programme that NDTi oversee. As an organisation, we're a not-for-profit organisation, very much based in inclusion, equality of people at risk of exclusion. And we do a whole range of different programmes, some of which are very much focused on policy and organisational development and transformation. And we also have a research and evaluation team, which is quite useful, I think, for this particular programme, Time to Talk, which one of them, which we're going to speak about. I work as the development lead for children and young people and families with a small team, and Carol's one of those. But we do work a lot on a range of programmes with disabled people, young people, people with mental health issues or autism and older people. So quite a broad section of work. Carol's just going to tell you a little bit about Preparing for Adulthood.
I'm hoping most of you know about Preparing for Adulthood, but if you do, you'll have seen this graphic before. We talk about 4 pathways, which are around helping young people into employment, around independence and independent living, community inclusion and health. And we emphasise the importance of a person-centred approach, so personalising the approach, important for every area to have a shared vision of what good would look like under each of these headings. When we started the reforms, we really were very aware there was a very limited range of post-16 options. Fortunately, that's got better in the last 10 years. We want people to have high expectations, raise aspirations, and we want people to work in partnership, because none of this stuff will happen without that partnership working. Thanks. Next one, please. Thanks.
So I'm going to just throw open this question and ask you, because I've had a look at who's here today in this workshop, and we've got people from obviously the SEND area, medical, health professionals, inclusion coordinators, and I'm hoping Carolyn's here from Contact, because she's been very involved in Contact have been involved in some of the work we've been doing. I just wonder if we could use the chat, and I might come out of the presentation so I can sort of take part in just a quick check-in together really about this question. From your experience, what challenges are young people, and here we're talking about 16 to 25-year-olds, with additional needs facing during the COVID-19 pandemic? Many of them have been referred to this morning, but I imagine you've come to this workshop because you've got a specific interest in this area, and you may as well have knowledge of the knock-on effects of these to their emotional resilience and mental well-being. And I would be interested to just have a moment, if I may, to speak to you all. I'm hoping you can't see my presentation at the moment. Is that right?
That's correct. Yeah.
Great.
People are typing now.
Great. Yeah. Just to get a feel really for the range of perspectives.
Family breakdown. Yeah.
Yeah.
Risk of hospital admission.
Risk of hospital admission, and we know that a lot of attention actually from NHS England, learning disability and autism Leeds has been put into admission avoidance, and that's been a really important part of some of the work that we've done through this programme. Yeah,
loss isolation, anxiety, bereavement.
Yeah. So just to kind of pick up on some of the
So I'm just going to read you a couple more. Lots of social opportunities, change to routines, lack of clubs, groups, activities. Yeah. Lack of respite. Yeah, for families, that's huge, isn't it? And also for some young people.
And a real sense of isolation as a result of lack of respite, where, you know, families are working under a lot of pressure at home just to try and keep things stable and to keep up a standard of care without necessarily that input from specialists who are unable to carry out therapies and so on.
Increased mental health difficulties, yeah. So uncertainty about next steps, lack of liaison between schools and colleges. Some felt a relief to be at home following very difficult experiences of bullying in mainstream. Yeah. Yeah.
And that's an interesting point, that last one, in relation to evidence from Adoption UK, where children with special educational needs who are adopted or have been in care, experience trauma, have actually, in some cases, their anxiety levels have become less as a result of not being in school. So we do have to kind of keep a balanced view. But the transition between settings is a really, really key point, yeah.
Okay.
Okay, thank you. Can you see my slides again now?
Yes, thank you.
Great. So what I wanted to do was make sure that in this workshop we appraised you of some work we've been doing at NDTi during the COVID-19 pandemic. And you've mentioned a lot of these issues already. We know that children and young people and indeed adults with learning disabilities and autism, or both, with mental health conditions and physical disabilities, are experiencing greater health inequalities than the rest of the population during COVID-19. And that's been particularly prevalent in the news this week from the work that Jo Wiley's done in relation to her sister, who with learning disabilities, and getting the vaccine rolled out to that cohort of people. It's been good to see that publicity in the press from our point of view. The lack of routine is definitely something that for all children and young people is a real problem, but actually for young people for whom the structure of being able to see familiar adults outside of their family and having a routine is absolutely essential for their well-being and their progression, their sense of being able to develop those skills for learning to be a little bit more independent. So a common issue can be that people lose the momentum they might have started through their education, or indeed even a placement, a work placement, or a job. They're going to be losing all the skills that they built up, and that's going to mean that when they go back after COVID, we're going to have to really think carefully about how to not only pick up those threads, but also instill enough confidence for young people to engage positively. Loss of social distancing measures can be really confusing for a lot of young people, and difficulties in accessing online or differentiated learning has come up as a big area of difficulty for young people with special educational needs and disabilities. And in some cases, it's not a reduction in support services, but they are looking very different. And in some areas, it has been a reduction. And certainly we found that through some of the young people and families that we've worked with. There's a lot of evidence online, through different research on just how impactful some of these changes have been for young people. And I've just mentioned there the COIVD research, because COIVD is such a useful tool in terms of mental health and resilience. although it would be, I think, interesting and not yet available to see how many young people with special educational needs and disabilities use COIVD, which is an online digital support which is rolled out across a number of CCG areas and commissioned to provide support for this age group. And then we know, don't we, that staff and indeed all the people around children, whether they be paid staff, volunteers or family members, are experiencing stress and mental health issues, challenges at least themselves. And that can have a very profound knock-on effect for young people. On the left, I've got a picture of, I'm just going to explain the slides because of the recording, and we may have some people with visual impairments listening to this. The slide has a picture of 2 children with masks on, and the statistic underneath is a child with a learning disability is 6 times more likely to present with a mental health difficulty throughout his or her life than a child without one. And that's not actually very recent research, but it's nonetheless useful, I think, as a backdrop. So NDTi developed a programme called Strengthening the Circle. I'll come on to that in a lot more detail on the next slide. We base a lot of our work on Boing Boing, which is an organisation based in Brighton's approach to resilience. Resilience is overcoming adversity whilst also potentially subtly changing or even dramatically transforming aspects of that adversity. It's an interesting issue that we cover a lot on Strengthening the Circle to actually discuss what we mean by resilience, and also asking young people themselves to assist us to think about what that means. And Boing Boing have done a fantastic combination of evidence-based research through Angie Hart, who's their chief executive, linked to the University of Sussex, on capturing young people's perspectives around what resilience means, as well as that evidence base. Beating the odds whilst changing the odds is a really popular way that young people feel it's equipping young people to manage adversity when it comes up in their lives, very much what we all believe in when we're working to develop their skills to prepare for adulthood. And another popular quote is inoculated resilience. So that's the theory that young people or children, all of us actually, need a taste of adversity in some cases to be able to develop resilience. So a life without any adversity could lead to a real lack of ability to be able to face adversity. And the photograph on the left is a picture that's very popular with groups of young people that we've done co-production with, because it shows a tree seemingly growing on a gap in the ground, i.e. its roots are not in the ground, but nonetheless it is growing, so it's facing huge adversity. So on this slide, I've just brought together a sort of sense of where on earth Time to Talk came from, which is the programme we're talking about in terms of developing young people's resilience. Strengthening the Circle is a specific programme that we've run at NDTi to enable non-specialist practitioners, so people who aren't going to call themselves mental health experts, but nonetheless have a key role in regularly supporting and seeing children, well, any child or young person. So this particular programme, Strengthening the Circle, is for all ages, people working with children of all ages. And it's about equipping them with confidence, competencies as well to improve emotional resilience and the mental health of children and young people. So we did an evaluation. We ran that programme out in 2017 and 18 through Health Education England. And the evaluation from that was really powerfully important, I suppose, in our confidence in, if you like, merging it with some of the really important tools that and learning that we've got from our delivery of the Preparing for Adulthood programme, which Carol described earlier. And together, what we've done is, obviously at the beginning of March 2020, it was evident that there was, from our partners and our stakeholders in particular in education and indeed in health and social care, that there was a real concern about young people 16 to 25 with additional needs who would be not engaging at all necessarily with services, and who may indeed not be engaging very much even to that point. So what we did was we put together this programme building strength-based support for emotional well-being, with all our learning from Strengthening the Circle, and just brought together a team from our children and young people's team to be supporters and to work directly online with young people for a fixed period of time, between sort of 4 to 6 sessions online, talking. It could be on the phone, it could be on WhatsApp, it could be on the laptop, Teams, Zoom, but just letting them have time to be heard and to talk to somebody. But then to also work towards thinking about aspirations and provide motivation. Carol, can you just give a bit of the context around levels?
Yeah, well, I think it's fair to say that it was something that we kind of wanted to get started quite quickly once we realised there were issues about a lot of young people's mental health. And so we were particularly interested in the 16 to 25 age group, partly because they could consent in their own right to participation. So it kind of simplified things to have the Mental Capacity Act, apply. And we had to find a way. We some of us, I think, anticipated that there was going to be a lot of demand for this service, and it's unusual for NDTi to be offering a direct delivery of any description, to be honest. But we felt that this was a gap, and we wanted it to be something that would help people to keep motivated. And so we set some sort of criteria, and they were reasonably loose, but we wanted people who rated themselves as having high levels of anxiety, people who had got limited aspirations. They weren't involved in any training or employment currently. They may have been on roll somewhere, but they weren't actually going into school or college. And they were young people who were less likely to be going out. I know there were restrictions for everybody, but we were trying to gauge, whether their anxiety was getting in the way of them going out. And we found that actually many of the requests came from young people. About a quarter of them came from young people directly. And most of the rest came from parents, a few professionals amongst this group. It was actually a lottery COVID fund specifically distributed to try and respond to the needs that were emerging as a result of the lockdown. So we didn't actually start until August. We got the funding through in August, and we actually started in September. And we were aiming to work with 50 young people, which is really a bit of a drop in the ocean, but we had to start somewhere. We were we had too many requests from really within 3 weeks. We had to say we couldn't take any more, and then started a waiting list. And so so it's gone on. We were working in partnership with Contact because we wanted to make sure that we could focus on the young people. And by working with Contact, we felt that although parents and carers were identifying issues, and they may themselves really need somebody to talk to, we could then direct them to Contact for that support. It kind of made it more straightforward in terms of the support that was being given to the young people. And otherwise it could have been quite a complicating factor. That didn't mean we weren't working with parents at all. It just meant that the whole session wasn't then taken over with families, by families. Thanks. Alice, could you move on to the next one?
Yeah, I just want to add as well, Carol, because I think it's really pertinent to the range of people here today that our research and evaluation team at NDTi carried out a independent evaluation of the project, which isn't yet finalised because the project is running up to the end of February. And in March, they will, we're going to bring you some early findings from that evaluation, but in March, there'll be a complete evaluation of the project. And I think it's important because this is a model that we were, if you like, piloting and bringing together a new sort of idea. It's not rocket science by any means, and there are a lot of different organisations providing important support for young people with additional needs, as you'll know. But what we'd like to do is inform future commissioning and ideas from our evaluation, so that you know, if you have any thoughts on that front or questions at the end, it'd be really good to hear them, because we can help cascade our learning, if you like. So very much based on our approach around person-centered conversations. First and foremost, so a young person might request support and then be set up with a supporter at our small team. Or obviously, because it's online, it was very easy to reach young people from across England, and we had a very good spread geographically, actually. And once they were set up, they would liaise with that person to decide how best they might want to engage. And the first and foremost, it was around just active listening and thinking about encouragement and motivation. And it was very marked, as you can imagine, just how low, or perhaps how sometimes reluctant to kind of first engage some young people were. So we had a number of people who chose not to speak, but wanted to do it through text. And we had some young people who used their PA, or usually their parent carer, to initially start a conversation with us. But the emphasis was on moving them on to being more independent and to engage with us independently as much as possible. So we tailored all the sessions to suit the individual, and that could include drawing, games, quizzes, test interviews for university, you know, anything that really was what was on their mind and what it felt was appropriate to them at the level of access that was right for them as well, but all around their strengths and their passions and their interests. So a really wonderfully empowering approach to build their trust initially, leading to where possible identifying, okay, so what sort of ideas have you got for yourself? You know, having talked about yourself, having thought about you and fed back, we often feed back to young people how we're hearing them describe themselves. Okay, so what is it that you might be able to explore in the future? If you could, what would you do? And then to find practical solutions with the young person about exploring opportunities, or indeed looking for them and bringing them to the young person and discussing them in sessions, and setting goals. And those don't necessarily have to be big plans. They can just be very personal goals. And we'll talk about one in a minute in relation to one of our case studies. Because of our sort of breadth of networks in preparing for adulthood, one of the really useful and very quick things we were able to do across the team was quickly link people with contacts and networks in their local area. So having realised quite quickly that some of these young people had no engagement with their community services or other important links that they could indeed get support from, we did quite a lot throughout the programme to sort of broker those relationships and make sure that they were used. So these are the tools. I don't know, Carol, would you like to just speak to the sort of overall tools on our website? Because
well, I can. Yeah, I can. Well, we have a suite of person-centered tools that were launched last year. Many of them are tools which, you know, have been around in the person-centered planning world for a long time, but they've just had a bit of a, you know, a refurb. But the one that's at the top there, which is called What Matters Island, is one we've used actually with groups of young people in schools and colleges, and we're kind of still working on, but we found it very useful in all sorts of ways. The idea is that you imagine that you're actually going to be on a desert island, and you have to think about, you know, what you're going to take with you, what things you're going to do when you're there, and who would be there with you if, you know, if you had your choice, who would be there with you. And you get people thinking about what people like and admire about them, the usual stuff that you would expect in good person-centered planning, and then you kind of think about what you're good at. You know, there's that question at the top, if I could, I would. So people are thinking, you know, it's forward thinking stuff really. What would I do in the future, and what would need to happen? So you kind of get people thinking about, if their wishes could come true, what would need to be put in place. So that's quite a useful tool, I think. What's working, what's not working. That's another one that has been around quite a long time, just as I say, just had a bit of a revamp. There's different ones. We've also got a tool in on our website, which I think is particularly helpful during COVID, because it's helping people to think about what's bothering them and what are their strategies to deal with, you know, the things that are bothering them. So there's a lot of really good tools on there. If you want to access them, they're all free to download.
So we just wanted to draw your attention to this because there are links to our website, and on our website, and indeed YouTube, are these vlogs, as they're called, and we found that they're really useful for inspiring people who already work with young people with additional needs around that person-centered approach. Barry and John worked on the team, and this is a conversation between them, and I'm not going to play it now because the workshop is relatively short, but I'll make sure that I put a link into the chat to the pages on our website. In this particular chat, they're talking about what matters, and it builds nicely on that whole conversation around the What Matters Island. And it sounds very simple, I know, but and I'm sure many of you are already seeing work which is person-centered, but nonetheless, it's been incredibly impactful to think about changing that question from what's the matter, which very often young people tend to be used to being asked, in particular when they're meeting a new adult and assume they're having some sort of assessment. And they possibly, you know, very often were listing their labels and diagnoses, actually switching that into, okay, so what matters to you? What is it that makes you tick? And actually gradually encouraging them to enjoy talking about themselves. I wanted to just bring one case study to you because, as with all these sort of programs, it helps kind of show how the program really works in practice for what can be a very, very broad range of young people. So you'll notice we never asked them to tell us their labels when they signed up. And actually, we never did ask that. So we were learning about young people from young people. And this particular young man was someone that I ended up supporting, and it was a very important kind of piece of learning for me, because I think working online at the beginning of the pandemic with young people felt very daunting. And this particular young man did not want to be on the screen at all. So his mum spoke a bit about him, and at certain points he would wave from under the table. So he was in the room, he was clearly around and listening, but he was not talking and not visible. So she explained that he'd not been out of the house for 3 years. He's a young person who's been excluded from school. He's experienced a lot of quite severe mental health issues, and having had a bereavement when he was just about 12 years old. So he was very reluctant to engage, and his experience of education had been poor. And in particular, his mum was very, very excited about engaging with the programme, but it was important that we quickly moved into it being his programme, and something that she was somebody who was directed to contact for the listening ear service, which was where, you know, very specifically going to assist her to talk about her son and some of her difficulties of feeling quite trapped. Their housing situation was particularly problematic as well. And what Max was able to do as a result of the programme was initially talk through his pets. So there was a lot of time where the camera was moved finally to looking at his rabbits that he had living in his house in a pen, and then gradually encouraging him to chat about them and give a talk about his interest in Xbox games. And all of this was quite gradual because of his reluctance to really talk or hear, even it would seem, hear his own voice with us talking. So lots of attention and time spent on very important to Max, you know, those key things, his important people and his pets and his Xbox. And he really hadn't, I don't think, been out of his room or spoken with anybody other than his mum for quite a long time. And what was interesting was that after Max had overcome that initial fear around hearing his own voice talking to us, or whether it was fear of his voice or whether it was just reluctance to engage with somebody outside of the other than his mum, it was actually really quick how much he decided that he was up for time to talk, the programme, but also making some ideas and plans for himself. And he developed the term mini goal, and he begun to talk about mini goals for himself. And those were to probably, it was to shower every day. So it was around personal hygiene. There was quite a lot of issues for Max around his personal hygiene, and developing healthy eating, and thinking about his diet. And then really excitingly, and in terms of seeing a transformation in a relatively short period of time with a young person, Max decided he would walk out of the house on his own. And this was, as you can see, his mother was amazed, actually. And the way that we worked on that was for him to photograph himself and send a photo back to me to just, and actually this is something that he still does from time to time, is send me photographs of himself out of the house. So hugely impactful for that family. And at the same time, behind the scenes, I was making sure that information was sent on different opportunities that Max and his mum might be able to follow up in their local area. So I mentioned earlier the evaluation, and I suppose it's here that I just want to make sure that you're aware of a kind of resource now that I suppose we've got to support perhaps development of similar programmes in your local area based upon this evaluation, which, as I say, will be finalised in March. So the impact on young people, we've got 3 quotes at the top there from young people themselves. And it's clear that the programme has had, where young people have engaged, had a significant impact on reducing their levels of anxiety and their thoughts about the future. You know, the fear of the future has turned into something far more positive for these young people. I felt like I was always listened to and not judged. I was very helpful, as I now have an idea of what I can do to help proceed into work. It was good to talk to someone who listened properly to my opinions. And due to the way in which we manage the evaluation, we've been able to collect some data. So 56% felt less lonely as a result of their support, and 75% of young people feel that they have a better idea of what they'd like to do in the future as a result of Time to Talk. And we collected evidence from carers as well, who saw that young people had increased their confidence, had begun to communicate more about their feelings, had become more excited about the future, and were engaging with other services available to them. So some really very impactful big changes in a relatively short period of time. So our contact details are at the end of this presentation. And if I can, I'd quite like to just come out of the presentation and just take any questions that you may have. Sorry. And also follow up with other information should you want it. Hi. Has anybody got any, I wonder if you could turn your cameras on and your, because I think we're a small enough group to see each other. Is that possible? Or you don't have to, but that can be quite a nice way for us to see you. Hi.
Yeah, if you want to put your hands up, I'll read out whoever's got a question.
Thank you. So are there any immediate thoughts for you? Or indeed clarification questions that you've got, as well as others?
Alice, there's a question about, was there specific training offered to the facilitators?
Not specifically, because we'd already got a team of people who'd got the training in person-centered planning, working with young people with SEND, and therefore being very sort of versatile about adapting techniques and methods of engagement. I suspect one of the main bits of learning we did as a team at the beginning was working online and how to creatively use the online platform with young people. So, for example, using What Matters Island, with being able to tap into it, and the young person could actually see what they were saying being added to graphics as they went along. But no others. And safeguarding. We had safeguarding.
Okay, so we all did safeguarding training, didn't we? Yeah. Madeleine.
Hi. I don't really have a question, but I just want to say thank you for the presentation, because it was actually very helpful. So I'm a consultant key worker for a new key working pilot in Hertfordshire. Oh, yeah. So we're in the transforming care team, and part of our role is to support children and young people who are at risk of admission to Tier 4. And we're brand new. I mean, I'm the newest member, but the key workers, they're now just starting to develop relationships with young people and going out and doing pretty much a lot of what you've just talked about. So it was really helpful to have those kind of resources and to think about that. I guess you just talked about the limits of, like, you did 5 to 7 sessions, and obviously we don't have that limit of time, but I just wondered, when you came to the end of that period, did you feel like, oh, there's so much more that I felt we could have done? Was you kind of limited in that, or did you feel like, actually, no, we've kind of done what we set out to do? Just about timing.
It's an excellent question, because certainly there were times where people in the team felt that, Magdalene, and yet in other situations where, for example, we have actually been asked to continue working with a young person in order to avoid admission. So we're working with NHS commissioners to provide this service while transition to adult services are being set up because of some gaps in provision. And that in that case, we've worked for quite a long time with one individual young person. And what's key there is noticing that shift from very proactive, clear purpose to building trust, developing next steps, and being very clear about the ending, to possibly developing dependency, if you're not careful, through becoming somebody who's a regular friend. And actually, what is your role? So I have read a lot about the key working role. I'm really excited about it. And I think you're quite right, this would be really pertinent. But I'll be really interested to talk to you about some of those issues outside of this, if you're interested, because I think it's tricky.
Audrey?
Hi, I'm just interested in where you sort of got your young people from. Was it via schools? Was it parent carer forums? So how did you sort of advertise the fact that the service was there in the first place, and how those referrals were made to you?
Do you want to answer that one, Carol?
I'm very happy to. Well, we did go through our existing networks, but including the parent carer forums, and we had an online system for people registering for the support. We made it clear that young people could sign up themselves. So I think that the reason we got such good geographic coverage was that actually all of the Preparing for Adulthood team actually distributed the information through their existing networks. And I don't think any one area actually had more than another, a greater number, significantly greater number, obviously some variation. And I think doing it through parent carer forums did generate a lot of interest, actually. I think it would be great if we were going to do it again, we could probably target young people's organisations as well. But there were a mix of professionals who were asking, for people to have places, some social workers, less education people than I think we thought. We were kind of anticipating there would be more requests from education than we got. But yeah, it was a mix of people. Yeah.
Thank you. Thanks.
Louise?
Yeah, hi there. Firstly, thank you very much for a great presentation. I was just thinking, we've got, it's not similar, but it is in many ways on the principles, a project about supporting anxious non-school attenders returning to school. And the goal isn't actually to get them back to school. It's about what do they want to achieve, and those small steps that would make life better for those, for whatever reason, around their mental health they aren't engaging. But during COVID, we've extended that to something fairly similar to your service, and our access into that is schools. So David, I'm really sorry, I've got a 4-year-old blowing raspberries. I'm so sorry. But yeah, it's very similar to that in terms of how we support the young person, but the schools have that. He's now been taken away. He's quite safe, everybody. I would just like to confirm that. But yeah, in terms of just those very early stages of children where schools are starting to see some non-engagement, whether that's through virtual, whether that's through that they're eligible for a school place, or where that's going through. So I think actually many of the resources you talked about will really enhance our project. So thank you very much. Thank you, really interesting. Thank you.
Can I just respond, just to add something, which is to say that the What Matters Island is being used by some teachers. In primary school as well as secondary school, so it's a resource that anybody can download. Yeah, thank you. Adele.
Hi everybody, a really good presentation. What an exciting piece of work. I guess my question is really how you might see this work linking into kind of NDTi's Young People's Advisor work, which is something that we're certainly trying to kind of build within Gloucestershire. So that's my first question, because yeah, there seems in my mind quite a strong crossover, and certainly from your evaluation it'd be really good to see where some of the kind of commissioning opportunities might come from that. And just also to say that in Gloucestershire we've got some future Me Gloucestershire youth representatives who are going to be working on a Preparing for Adulthood toolkit together with the NDTi Young People's Advisor, and it'd be really good to kind of integrate, I think, some of the ideas around time to talk, to really encourage that. And my third one is just well done for kind of working with Contact, because parents are so important, but can be such a barrier as well. sometimes to those preparing for adulthood conversations with young people. And so it's just really interesting to see how you were able to balance maybe anxiety the parents might have about these conversations, and of course their desire to support their young person, but also that ability then just to enable them to kind of take the lead and speak as they are, as people themselves, as individuals.
Thanks, Adele.
I'm sorry to interrupt, Alice. Just to give you a bit of a time warning that we're running close to the end of the session now, and the second workshop starts at 12:30. So we'll have to start thinking about wrapping up soon. Sorry.
Okay. Thank you, Dan. I don't know whether you want to respond to Adele's point about Sendias, Alice.
Yeah, I just wanted to mention, Adele, that we've done some work with Gloucestershire in the past, actually, in terms of their work on the PFA, preparing for adulthood, local offer and so on. And I know Carol's been involved in that. But I mentioned Strengthening the Circle. It is a training programme that we're running nationally. And what's been absolutely fantastic, actually, has been to bring the learning from Time to Talk into direct training and delivery and reflective practice for practitioners working across, all education, health and social care. So I will make sure that we send information out about Strengthening the Circle, which is an ongoing programme, but actually even just snippets and workshops and learning, there's quite a lot of it on our website for NDTi, and I'll make sure I send that through to you.
Brilliant, thank you.
Alice, I've just taken the liberty of putting your email address in the chat, okay?
Yes, I'm not very good at putting things in the chat while talking to people. I'm still not very good at that.
Thank you. I think we've got to come to an end, actually. It's already 29 minutes past and we're running another session in just a minute. So thank you, everybody. And thanks for everybody's comments and questions and so on. So thanks.
Thank you.
Thanks a lot, both. Take care.
Bye.
Bye.